doctor's dignity is torn apart, both publicly and mercilessly. Vishwajit Rane issued an apology on Twitter. Dr. Rudresh Kuttikar dismissed it as a studio apology. This is not legal, this is not transparent, this is not ethical. This is a classic case of misplaced priorities. I am Dr. Mithun, and today we are breaking that silence. A senior doctor doing his duty in a crowded casualty ward. A minister walks in with a camera crew, and within minutes, doctor's dignity is torn apart, both publicly and mercilessly. What followed was not just outrage, it was a question every doctor asked themselves. If this can happen to him, could I be next? This is not just about one vitamin B12 injection. This is about power, respect, accountability, and the dangerous silence in our healthcare system. I am Dr. Mithun, and today we are breaking that silence. So I will start with the new updates on this incident. Health Minister Vishwajit Rane issued an apology on Twitter, calling his words harsh, attributing them to an emotional outburst. Dr. Rudresh Kuttikar dismissed it as a studio apology, demanding a public apology in the casualty ward, the exact place where the incident occurred, within 24 hours. The Goa Association of Resident Doctors has set a 24-hour deadline for a live in-person apology. They have told about a massive shutdown or strike if their demand is ignored. Over 600 doctors, consultants, interns, and students staged a protest on campus. They labeled Rane's actions degrading and arbitrary and demand respect, not public humiliation. Goa CM Pramod Sawant stepped in on June 8, overturning the suspension and stating Dr. Kuttikar would not be suspended. CM is yet to visit GMC and has been asked by the doctors to bring Rane along. Breaking down this incident, these are the reasons why Dr. Kuttikar deserve our respect. Dr. Kuttikar was managing an overloaded emergency unit, possibly dealing with life-threatening cases. Vitamin B12 deficiency is not an acute emergency unless part of severe anemia or neurological compromise, which has not been the case here. He likely made a clinical decision to prioritize other patients at that moment. Even if there was a difference in opinion, it should have handled privately, not in front of patients, relatives, staffs, and cameras. Leaders should correct junior staffs with dignity, especially in high-stress environments. The minister's public tone doesn't show morality and set a dangerous precedent and may discourage doctors from working in government service. How can a doctor be suspended without a basic inquiry? Where is the natural justice? There was no internal fact-finding, departmental review, or disciplinary hearing before announcing a suspension in front of the media. This is not legal, this is not transparent, this is not ethical. It sends a chilling message. You are guilty just because someone powerful says so. In most adult patients, vitamin B12 injections can be replaced by oral tablets. That is standard practice. Evidence show that oral tablets 1000 to 2000 mics per day is effective in most deficiency cases. If the doctor opted to prescribe vitamin B12 tablets instead of an injection, that is clinically sound. The decision depends upon patient condition, not political optics. Doctors are not punching bags for public frustration. If something goes wrong in healthcare, doctors are blamed first, even if it is a system that failed. The real crisis is going in Goa's hospitals. Instead of fixing this, health minister is micromanaging a doctor's clinical decision. Dr. Kuttikar became a scapegoat for much bigger systemic problems. The doctor didn't ask for fame. He asked that if his humiliation happened publicly, so should the apology. This is not about revenge. It's about restoring professional dignity. A studio apology read on phone does not match the damage caused publicly in front of the camera. We demand accountability in medicine, but accountability works both the ways. Even ministers should admit when they have crossed the line. Today we are not defending a single doctor. We are defending the dignity of every doctor under pressure, every nurse who is blamed unfairly, and every young professional who deserves a system, not a spectacle. Now you can see where the health minister went wrong. His action was completely unprofessional and inappropriate. This sends a message of intimidation, not leadership. Doctors are his team, but when things got political, he threw one under the bus. At a time when the doctors face long hours, verbal abuse, burnout. He should be protecting them, not abusing them. His actions created fear among the junior doctors and demoralized the entire medical community in Goa. The health system is bleeding in Goa, but minister is arguing over a vitamin shot. Instead of micromanaging vitamin B12 decisions, here is what minister should fix. Goa is short by 71 subcenters, 20 PHCs and 6 CHCs. Over 50% specialist vacancies in GMCs and other district hospitals. 108 ambulance delays in South Goa caused patient death. No drivers in hospitals like Hospicio. Stock outs of essential medicines. No centralized drug procurement system or quality checks. Disruption of hospital internet access to patients' data and diagnostics. TB cases still reporting daily. Malaria threat from imported cases still remain. High stress, overwork, and no support system for junior doctors. But instead of solving these, minister picked an easy target to look powerful in front of the camera. This is a classic case of misplaced priorities. When you humiliate someone publicly, your apology also should match that level, not be a rehearsed video on your phone. When the doctors start practicing defensively or fearfully, patients are the ones who suffer. After this incident, many doctors will hesitate to take bold clinical decisions. That's a dangerous culture and minister is responsible for creating it. A health system doesn't collapse overnight. It crumbles quietly when the real problems are ignored and the people who speak up are punished. Dr. Rudresh Kuttikar did not deserve what happened to him, and every doctor, every nurse, every intern, you deserve better too. To the minister, fix what is broken, support those who save lives. To the public, stand with your doctors. We fight for your lives even when no camera is rolling. And to my fellow doctors, stay strong, stay ethical, stay loud. Because the white coat is not just a uniform, it is a responsibility and a right to be respected. Thank you so much.